Heart disease is the number one killer in women. So heart
Mhm.
disease, cardiovascular disease, your brain fog, your brain health is impacted by the lack of estrogen. Your
Hi, everyone, and welcome back to our menopause series. I'm Reshma Tiwari, and I'm here with my co host Swati Singh, who's our menopause coach and who really helps women navigate this powerful stage of life, and that too with confidence. So, today we are diving into a topic that sparks a lot of questions and myths. That's really HRT, or the hormone replacement therapy. And our goal today is to help you make a very informed and confident choices about your health without confusion or fear that's related to this topic. So, hopefully, our discussions with Swati will help alleviate those fears. So, without further ado, Swati, let's dive right in. So, if you just want to clarify what exactly is HRT and how does it work?
Yeah. So HRT, as you said, hormone replacement therapy. It's also called AMHT, which is menopause hormone therapy. It's basically a combination of hormones. We have all these hormones like estrogen, progesterone, vaginal
Mhm.
estradiol, and testosterone. So estrogen is actually a group of hormones. Among that, estradiol is the most powerful and the main dominant hormone. So when we get these therapies, this basically is a combination of these four major. But then you have to understand that this is not like a one size fits all. It's customized as per the individual. What happened earlier was these hormones were synthetic. They were mostly synthetic hormones and the estrogen came in pills. But now what we have is more advanced and bioidentical version, which is the safest form to have it. Like the estrogen, the biggest way to take systemic estradiol is through patches. And these patches are the safest form. And it's just a little patch. You put it on your skin and you change it like twice a week. And then the progesterone comes in
Oh.
pills. So you take, and then for vaginal estradiol, there is
So,
a
you can
cream
do
that
your daily, with these patches, you can do your daily activities, no interruptions, nothing that
absolutely. It's a very
very
tiny
easy.
pack. It's almost like a sellotape that you just put a small square on your skin and under
Okay.
your clothing, and that's it. It doesn't interrupt with anything. You just change it twice a week. You take a progesterone pill. This progesterone pill helps you sleep like a baby. It does a lot of other things in your body, but it also relaxes your and it helps you get like amazing sleep. You will feel the difference once you get up in the morning. This is simply a combination, and it can be very easily adjusted as per your need. As I said, it's not one size fits all. Once your doctor goes through your blood work and everything, they will decide what is the right combination for you, and the benefits that it gives is just unparalleled. Protects, basically is replenishing all the hormones that you were you know, not making through your ovaries. Because at the age of 40,
Mhm.
45, ovaries start failing, and the kind of hormones they used to produce earlier, they barely produce like 5% of it. So you are lacking 95% on this hormone therapy, or the combination of pills and gels and patches actually replenish the hormone in your body, and everything that you are facing due to lack of hormones can be helped and fixed, kind of thing. Yes.
It's wonderful. No, that's excellent. So,
Right.
who would be a good candidate of HRT? Like, and who should really avoid it? Or is it even a thing that someone should even avoid it? Like, should they not at least try it out? What would
Yeah.
your thoughts be?
I think that's an amazing question, because a lot of women think that they probably are not a good candidate. But as I said, because the doctors kind of customize it for you, most of the women, I would say 95% of the women can be a good candidate for hormones. Because think about it, just like as I said, that it is replenishing the hormones that you had in your body and which you don't have anymore. So everything that
Mhm.
your body is going through, from brain to heart to bones to urogenital, all these organs that are suffering due to lack of all these hormones, basically you are replenishing it. So 95% of them are good candidates. However, before you get these prescriptions, they will actually get your proper blood count done, get
Blood
your
work.
family
Right.
history checked, and everything. However, we heard that women who had cancer also can be a good candidate for hormones. Can you believe it? It's just that it should not
Wow.
be a hormone induced. Yes. So a lot of cancer survivors, women, also can safely take this HRT. So I would say that most women are a good candidate. Very few may not be, but that is for your provider to get your thorough family history, your blood work, and your current health condition. If you are way ahead in your heart disease or something, then you probably may not be the right candidate. And that is the reason why I keep emphasizing that, ladies, if you are already in peri or menopausal journey, please consider HRT now versus 10 years later, because once you are in the advanced journey of heart disease or anything, we cannot reverse it. These hormones are protective, preventive, they cannot cure. So you have to understand that.
You told me that's a good point. I do have, just to let you know, I have my meeting with my OB in the next, I think it's end of this month, where I am actually going to bring
Right.
up HRT. I already feel a lot of the many perimenopausal symptoms, so I will be having my candid discussion, and hopefully, I am also a candidate for HRT. So I'm looking forward to that discussion.
Actually, yeah, you know what? That makes candidate, because trying to get this help in your peri journey will make you way
Mhm.
ahead, because you will be replenishing it before you start seeing the damage in your body. So this is just awesome,
Good to
Reshma.
know.
Go ahead and have this conversation, know your facts, and then, make a decision.
Yeah, no, and I'm glad you have been. It has been delightful to understand all these nuances from you, and I can't wait to talk to my OB. But again, even from you, I would want to understand, and I'm sure as our audience will, what are the real risks and benefits of HRT?
So, as I said, risks, everything has some kind of risk side effects. Even our over the counter painkillers that are so called safe, Tylenol, everything has their own, thing. It damages puts pressure on your liver and all, like your sugar medication, your BP medication. Everything has some kind of side effect. However, when it comes to hormones, the benefits heavily outweighs the risks. I don't understand what is the fear. I mean, I understand that WHI is the study that WHI did, and the media, whatever,
Right.
said in
I did.
2002 is the actual fear it is causing. It is so sad that it is 22 years since that study was done, and it has been 22 years, and only 4-5% of the women are back on HRT. Earlier, you would not believe, there was 40% of the women who used to be on
Wow.
hormone therapy.
Wow.
Before this study, we had a big number of women who were actually getting this help and thriving on it. But after this study, everybody like threw away their hormones and everybody got scared. And it's been 22 years and we are still not out of this fear. This will probably cause cancer. And only 4 to 5% of
Right.
the women are back on HRT. So we all have to work hard, create awareness to make people understand that study, that news was not true. So know your facts and get help.
Okay.
When
Yep.
you also say benefits, but when
Right.
we were talking about the risk, when you say benefit, it's basically very protective of your heart. Now, heart disease is the number one killer in women. So, heart
Mhm.
disease, cardiovascular disease, your brain fog, your brain health is impacted by the lack of estrogen. Your brain
I'm
fog, the
feeling
things
it.
that you forget, the anxiety. Yeah, yeah, right? This is real. And the benefits of HRT will be seen on all this. And
Okay.
bone loss. Bone loss is real. Once you hit perimenopause, menopause, the bone loss decline is rapid. You know what? I was listening to Dr. Wanda Wright, who's a ortho doctor, and she's a big advocate for menopause therapy and HRT. She was saying, how do you know that you are at risk of osteopenia or osteoporosis even without going for a bone scan? Is look at your mom. If your mom in her 70s and 80s, if she's shrinking, if you see that she's not as tall as she used to be, if she looks frail, that means you're also a good candidate for osteopenia and osteoporosis, because
For
she is
sure.
suffering from it.
Yeah.
That is the tiny multiple fractures that her bones are having, and that's why her size is actually shrinking. So look
Shrinking.
at your mom and see her health condition. If she is suffering from heart condition, if she is suffering from fragile bone and all that, basically you are going to be that person 20 years later
Yeah.
if you don't take action. Don't change your diet, don't change your exercise, don't change your supplements, and if you don't take help from hormones. So the
Yep. Yeah.
benefits
No, very
are
true.
huge. And as I
It's genetic. So our genetic
it does impact
medium through our
100%.
family will come down. So yeah,
Yes.
like I said, I'm excited and I'm glad you're bringing up this awareness and the benefits of HRT. But if someone doesn't want to take HRT, are there any natural or alternate options for these ladies and individuals?
I'm so glad that you brought this up, Reshma, because a lot of friends keep asking me, Swati, do we have to take HRT? Is there any natural way to take this? You have to understand, we can do so much naturally. We can definitely change our diet, do exercise, do everything else. But how will you naturally replenish your hormone through food? Like
Mm,
100% replenishing the hormones through food is not possible. And this fear, again, we are talking about this, like if you lose your eyesight, if you have a problem, we wear glasses. That's not done naturally. If you have a heart condition, we put stent. It's not done naturally. Everything when our body fails, even for thyroid, right? We take pills. That's also a hormone. So all these things that we suffer and we treat it with whatever treatment is needed. It is not done naturally. So I don't understand why people keep asking, why do we have to take hormones? Can we not do it naturally? Because it's not done naturally. Right. So I think we have to
yeah.
understand that every other condition we go and treat it from outside. So this is also one of them. If our body is not making hormones anymore, so we will have to take hormones from outside, and there is nothing wrong with it. And of course, you will do that in a doctor's supervision. I know that there are some estrogen pills that are available, and I don't know how safe they are, how formulated they are. So whenever you want to consider this, you will have to do under a guided supervision of your care provider. Yeah. So I would not suggest to you go ahead and do it on your own. It is
Yeah. And
not
I
one
remember
size fits all.
I remember having this
So
discussion once with you where I said, a friend had mentioned that, she or her sister really didn't see any effects from this hormone replacement therapy. And I think the key messaging here would be that women actually need to go back to their care provider and see if they need adjustments, right? In
yeah.
the dosage that they're getting.
Correct. And as I said, if there is a condition that you are like far ahead on it, it's not going to cure it, but it will definitely reduce it from getting worse. So hormone prevents more than cures. So you have to understand that fact that this is not a medication but of course it will fix the symptoms, fix the night sweats and the brain fog because it is replenishing the hormones in your body. So everything that your body is going through due to lack of hormones will be prevented. That will be for sure. Yeah.
Okay, wonderful. So that was a very good session. As always, Swati, it's always a pleasure to talk to you. And this brings us to our end of this very evidence based discussion that we are having on HRT for now, because this topic really deserves this honest conversation. And as Swati had said, it's not one size fits all, it's not a solution. It's going to be the same for everyone when it comes to menopause care, because every woman's journey and medical history and family history is very unique. But I will say that if you have found this episode helpful, don't forget to share it with your friend who might be navigating some of the same questions that we are going through, especially me. And this is really helpful for me. And I am going to go to my next step in hopefully 2 weeks and explore this whole world of HRT. So please, if you have any thoughts or suggestions as to what you would like to hear from us and what we should be discussing, please do put that in our comments as we continue breaking the silence around menopause with our lovely menopause coach, as well as any other topics. Please do let us know. Right, Swati?
Yeah. Yeah. Thank you for clarifying this, Reshma, that we are happy to discuss if people have any more questions. And ladies, I just want to tell you this, that this is not a conversation that I'm telling you that everybody needs to go on HRT, but you have to know the facts. Get this conversation going with your doctor. Understand the pros and cons, the benefits and the risks, because the risks are very less, the benefits are huge. End of the day, it is your body, it's your decision, it's your life. It's your choice whether you want to take hormone and thrive on it or you don't want to take that. It is ultimately your choice. And for me, I want to say that I chose HRT and I'm thriving on it, and I want the same for you guys. So ladies, be bold, be well, be you. See you in the next episode. Bye for now. Thank you.
Bye. Thank you.